Hey guys, Walker Patrick, nursing educator in Psych Rosetta, and today we're going to show you how to easily identify all of your heart blocks and make it very simple for you. And you can identify these in literally less than 5 seconds. And believe me guys, this is probably one of the most talked about rhythms, and a lot of people have issues with them and struggling with them. But guys, I'm telling you right now, heart blocks are actually one of the easiest ones to identify. I'm going to tell you how. The only thing you need to pay attention to is the PR interval. If you guys just simply single out the PR interval, you're going to understand how to easily identify all of your heart blocks, and you can literally understand it in less than 5 seconds. A lot of times people overcomplicate it. There's lots of other courses out there that try to explain it in different ways. But guys, I'm telling you right now, if you know the PR interval characteristics with each one of these heart blocks, it's extremely easy. So your options with heart blocks is first degree heart block, second degree type 1 heart block, second degree type 2 heart block, and third degree heart block. So there's 4 options. Once again, guys, I want you to only look at the PR interval when you know it's a heart block. So let's get right into it. First degree heart block, what is it? A first degree heart block is the only heart block that will not actually have a complete block or drop of a QRS complex. So if you guys know that heart blocks literally means that there is a block from the P wave to the QRS complex. All right, so you're going to see P waves that are just there by themselves that don't actually reach the ventricles to stimulate a ventricular contraction. So that's what a heart block actually is. Well, first degree heart block is the only heart block out of your 4 options that doesn't actually get completely blocked, and it doesn't actually drop a QRS complex. So the main characteristic of a first degree heart block, once again, only look at your PR interval, is a prolonged PR interval. You're not going to see any P waves without a QRS complex following. So if you guys remember, the PR interval is 0.12 seconds to 0.2 seconds, which is 5 small boxes. So the characteristic of a first degree heart block is a PR interval that is greater than 5 small boxes. And once again, you should not see any P waves without a QRS complex. That is your first degree heart block. But for just the sake of it, let's go through those steps of EKG interpretation. Step number 1, let's find the P wave. Is it upright? Is it before every QRS complex? And is it ever absent? So you see that the P wave is checking out here, so let's move on to step number 2, which is what you need to look at for every one of your heart block interpretations. Step number 2 is determining the PR interval. All right, so let's measure it out. We see here that the PR interval in this case, in this example, is 0.28 seconds. So it is 7 small boxes. All right, but I don't see any heart blocks per se. There's not actually any dropped QRS complexes. So once again, that characteristic of a first degree heart block is just a prolonged PR interval. So that's what we got here. All right, so we have a first degree AV block. Let's make sure there's not any ventricular arrhythmias and so on and so forth. So step number 3 is measuring the QRS complex. It checks out because it's less than those 3 small boxes. And then step number 4, measure the rate and rhythm. The rate here in this case is 1, 2, 3, 4, 5, 6. So 60 beats per minute. We're using that 6-second strip method, which is the most common. All right, and then measuring the rhythm out. The rhythm here is checking out because it's consistent between each of those R to R intervals. All right, so this would be first degree heart block. All right, so second degree heart block type 1. This is also known as winky block. Now you might know already that a lot of people like to use the mnemonic longer drop winky block. All right, well that actually is a very good mnemonic. I'm not a huge fan of a lot of mnemonics, but that is a good mnemonic because it actually tells you what to look out for. But the highlights of a second degree type 1 heart block is that the PR interval is progressively getting longer with each QRS complex, and eventually it does cause a complete block. So you have your PR interval that's longer, and then looky there, you have a drop. So let's actually measure out the PR interval. The first one is 0.28 seconds. The second one is 0.56 seconds. The third one is 0.72 seconds. As you guys can see here, that PR interval is getting longer and longer, and then eventually you're going to see a P wave without a QRS complex, which is called a drop. So that is how you know that it is a winky block, because it's a second degree AV block type 1. All right, so if you go through this EKG step, all right, so step number 1, you look at the P wave. It checks out because it's upright, it's not inverted or anything, and it's before every QRS complex. And then you have step number 2, which is how you determine every heart block. We have the PR interval. As we just mentioned, second degree type 1 is characterized by a longer PR interval that prolongs over time and eventually causes a complete block. Step number 3, let's measure the QRS complex. The QRS complex is okay because it's less than those 3 small boxes, so it's not a ventricular arrhythmia of any sort. Step number 4, measure the rate and the rhythm. Our rate here is 1, 2, 3, 4, 5, so 50 beats per minute. And our rhythm checks out because the R-to-R intervals are consistent. Hey guys, it's Will Kirkpatrick, nursing educator inside Coursera. I wanted to let you guys know that I will help you with anything you need at any time if you just send me a text at 940-218-4062, 940-218-4062. Let's get back to the video. All right, moving on to second degree block type 2. So this is also called a Mobitz 2. So what I want you guys to know, a lot of people get confused between second degree type 2 versus third degree heart block. This is where people get really confusing when they try to teach this stuff. But please, literally only look at the PR interval. That is how you're going to know the difference. So the biggest rule I can tell you with second degree type 2 heart block is that the PR interval is always the same. All right, so don't look at anything else. I'm telling you right now, once you know it's a heart block and you're trying to determine, okay, which heart block is it? If that PR interval is always the same, and then there's also, of course, random blocks throughout the rhythm, that is second degree type 2, which we'll get into what third degree heart block is. But if you guys know that you're seeing random blocks throughout there, of course, you're going to know that third degree heart block has random blocks too. But how you know the difference between second degree type 2 versus third degree is that the PR interval is always the same. So let's look at this rhythm here. We have blocks that, as you can see here, we're showing you highlighted blocks without a QRS complex. There's POAs by themselves. But look at the PR intervals throughout the entire rhythm strip. We have a consistent 0.28 seconds throughout the entire rhythm strip. That PR interval is always the same. All right, guys, so remember that. That's how you find out if it's second degree type 2. All right, so moving on to third degree heart block. As I said, this really gets confused a lot of the times, and how people actually teach it kind of gets really confusing as well. So if you look at the PR interval and only the PR interval, you know, here's the rule. PR intervals are never the same in third degree heart block. All right, so we know that we talked about second degree type 2 where it's always the same. Well, in third degree heart block, it's never the same. So it is literally that simple on how to determine second degree type 2 versus third degree heart block. All right, so as you guys can see here, there's blocks throughout the entire rhythm, right? But look at the PR intervals. If the PR intervals are not consistent throughout the entire rhythm, then you know that this is a third degree heart block. All right, guys, that is how you easily interpret heart blocks with your EKG interpretation exam. I hope we made it very simple for you guys. If you guys haven't already, make sure you guys download our free EKG study guide and our website on tactilevr.com, and it's also in the link in the description below. I look forward to helping you guys in the future. Thank you guys for watching. We'll see you in the next video. Hey guys, first of all, thank you so much for watching the video entirely through. It makes our day if we know that nursing school got a little bit easier after watching one of our videos. If you guys like this video, make sure you like it, subscribe to the channel for more, and drop down in the comments for any more ideas that you need help with nursing school. If you want to contact me personally, it's 940-218-4062. Thank you guys for watching. We'll see you in the next video.